Hey guys, this is FixerMed. Welcome back to my ECG Skills Builder Workshop, where I will be covering all of the fundamental knowledge and skills you will need to read and interpret an ECG in a quick and effective manner. This will be part 14 of my multi-part video series of doing so. Today, I will be covering the rhythm of the heart in greater detail. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up by covering an overview of sinus rhythms irregularities. Sinus bradycardia, unusually slow heartbeat originating from the SA node. Sinus tachycardia, increased heart rate, but rhythm still originates in the SA node. P wave might be hidden but is present. Sinus arrhythmia, normal increase in heart rate during inspiration. Absence might suggest autonomic neuropathy. All right, now let's look at some visual representations of the sinus rhythm irregularities we discussed in the last slide. Sinus bradycardia is a heart rhythm where the resting rate is below 60 beats per minute, BPM, resulting from the sinoatrial node firing less than 60 times per minute. Sinus tachycardia describes a heart rhythm where the rate exceeds the normal range of 60, 100 beats per minute, BPM, stemming from an increased discharge rate of the sinoatrial node surpassing the upper limit of normal activity. Sinus arrhythmia, also known as regularly irregular sinus rhythm, is a deviation from normal sinus rhythm characterized by variations in the PP interval, the duration between consecutive P waves exceeding 10%. All right, let's take a look at tachycardias. Ventricular tachycardia is always pathological. Supraventricular tachycardia, SVT, may not always be pathological. Reentry is the most common cause of pathological tachycardias and arrhythmias. Let's take a further look at reentry. Signal splits around a circuit. One side conducts slower. Slow signal meets the fast side after repolarization, causing both normal and retrograde depolarization. Let's take a look at paroxysmal atrial tachycardias and multifocal atrial tachycardias. Paroxysmal atrial tachycardia, PAT. Reentry in the atria causing rapid tachycardia. Single ectopic pacemaker, often the AV node. Inverted P waves. Multifocal atrial tachycardia, MAT. Two or more asynchronous pacemakers in the atria. Hallmark is multiple P wave morphologies. Let's take a look at atrial extrasystoles. Arise from ectopic atrial foci. Beat usually occurs at the same time after the sinus beat. Differentiate from atrial escape beat, where the SA node falters. Let's take a look at atrial flutter, sawtooth baseline F waves on ECG. Atrial rate 250, 350 beats, min ventricular rate, typically 150 beats, min, 1 block. Let's take a look at atrial fibrillation. No P waves, oscillating baseline, fibrillation waves. Atrial rate 350, 600 beats slash min. Ventricular rate 100, 180 beats a min. Let's take a look at ventricular extrasystoles. Wide, bizarre QRS complex unrelated to a preceding P wave. Constant relationship between preceding sinus beat and subsequent ventricular beat. More common with slower heart rates. Let's take a look at ventricular tachycardia, caused by reentry of the depolarization signal in ischemic or necrotic tissue around bundles. Life-threatening condition. Hallmark is wide QRS complex. Let's take a look at ventricular flutter and ventricular fibrillation. Ventricular flutter. Bizarre sine wave rhythm often degenerates into ventricular fibrillation. Ventricular fibrillation, complete breakdown of synchronized myocardial conduction, requires defibrillation. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 75-year-old man presents with a rapid and irregular heartbeat. His electrocardiogram, ECG, shows an undulating sawtooth pattern with an atrial rate of 320 beats per minute and a ventricular rate of 160 beats per minute. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, atrial flutter. The key features in this case are the rapid and irregular heartbeat, the sawtooth pattern on the ECG, indicative of flutter waves, the high atrial rate, consistent with atrial flutter's range of 250 to 350 beats per minute, and the ventricular rate being exactly half of the atrial rate, suggesting a 2-1 atrioventricular block, which is common in atrial flutter. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Sinus tachycardia. While this condition involves a fast heart rate, the rhythm remains regular, and the ECG would not show the characteristic sawtooth pattern seen in atrial flutter. B. Atrial fibrillation. This arrhythmia also presents with a rapid and irregular heartbeat, but the ECG would show an irregular, chaotic baseline with fibrillatory waves, not the organized sawtooth pattern of atrial flutter. D. Ventricular tachycardia. This is a life-threatening condition characterized by a wide QRS complex on the ECG, which is not described in the scenario. Additionally, the heart rate described is more consistent with atrial flutter than ventricular tachycardia. E. Multifocal atrial tachycardia. This arrhythmia involves multiple ectopic pacemakers in the atria, leading to varying P-wave morphologies on the ECG. However, the scenario describes a consistent sawtooth pattern, which is not typical of multifocal atrial tachycardia. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old woman experiences episodes of a racing heart that start and stop suddenly. During these episodes, her ECG shows a regular rhythm with a heart rate of 180 beats per minute. The P waves are inverted, appearing before each QRS complex. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, paroxysmal atrial tachycardia. The key features in this case are the episodes of a racing heart that start and stop suddenly, paroxysmal, the regular rhythm during these episodes, the fast heart rate, and the presence of inverted P waves. Inverted P waves suggest that the electrical impulse originates from a location lower than the SA node, such as the AV node, which is a common characteristic of paroxysmal atrial tachycardia. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Sinus tachycardia. Although the heart rate is fast, sinus tachycardia typically doesn't have abrupt starts and stops, and the P waves would be upright, not inverted. B. Atrial fibrillation. This arrhythmia presents with an irregular rhythm, unlike the regular rhythm described in the scenario. C. Atrial flutter. Atrial flutter would show a sawtooth pattern on the ECG due to flutter waves, which is not mentioned in the scenario. Additionally, the P waves would not be clearly identifiable. E. Ventricular tachycardia. This serious condition would display a wide QRS complex on the ECG, which is not described in the scenario. The described heart rate and P-wave morphology are more consistent with PAT. All right, now that we have covered this question, let's move on to look at the next question. A 25-year-old healthy woman reports occasional skipped beats that are followed by a strong thump in her chest. Her ECG shows normal sinus rhythm with occasional wide and bizarre QRS complexes that are not preceded by P waves. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, ventricular extrasystoles. The key features in this case are the skipped beat sensation caused by the extrasystole, followed by a strong thump due to the compensatory pause after the extra beat, and the presence of wide and bizarre QRS complexes without preceding P waves on the ECG. These are all characteristic of ventricular extrasystoles, which are extra heartbeats originating from the ventricles. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Sinus arrhythmia. This is a normal variation in heart rate with respiration and would not cause skipped beats or abnormal QRS complexes. B. Atrial flutter. Atrial flutter would show a sawtooth pattern on the ECG due to flutter waves, not isolated abnormal QRS complexes. D. Paroxysmal atrial tachycardia. This condition involves episodes of a rapid heart rate with irregular rhythm, which is not consistent with the described symptoms. E. Multifocal atrial tachycardia. This arrhythmia would show multiple different P wave morphologies on the ECG, which is not mentioned in the scenario. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.